So I was actually quite a late comer to internal medicine, but I think that I've really enjoyed it and found a home there and eventually chose general internal medicine because I think that it's really rewarding to be able to take care of patients and families longitudinally, and I think that the work is complex and challenging, and I get to do something different every day, which is rewarding to me. So every patient has a story, and I think that really in the first visit, it's me to get to know that narrative. So it's really speaking, about their past medical history, their experiences with other physicians, and really what their goals are. Because often patients come with a lot of questions, and maybe more questions than answers, at least to that point in, their medical life cycle, so to speak. And I think that first visit is really critical to, one, set some goals for where do you see yourself a year from now with me, and what does that look like? And I think really partnering to say, okay, here are the things that I see that maybe are opportunities for us. And so really how I see it is we kind of discuss these issues together, and then we decide what the priorities are. What are the things we want to work on now? And then what are our kind of short-term, medium-term, and long-term goals for, the overall health? So I think that's really the key. And I think that it's really my job to share that decision and to discuss that with the patients. When the patients come back and they say, I did try some of those things that you'd recommended and it made a significant impact on my life. That's the most rewarding thing, is to really see and hear those stories in action. I think it's something that we love as physicians, I think, in general, but as a primary care physician, I think even more so, because you really are a part of their lives. We own a 31-acre farm, which I think is a fun fact. So we have 18 horses, and we just got our first pig. So that's been quite an adventure, and my life outside of medicine is very different from, I think, a lot of people around here. But it's been a lot of fun to do that.